At what point do doctors recommend dialysis? Okay, a lot of people ask me this question, and in today's video, I want to dissect reasons why a doctor may actually recommend dialysis for someone who has kidney failure or someone who has challenge with their kidneys. Okay, one of the core challenges for people who have kidney stones, kidney infection, and kidney cyst and other kidney related issue is that they are scared that the condition may actually deteriorate to kidney failure. So some of them who have treated this condition for a very long time, they are even worried, would my doctor recommend dialysis for me? And some people, one of their worry is that when they now bring up their kidney function test, and they are now worried like this kidney function test I'm presenting right now, would I be actually needing dialysis? So in this video, I want to discuss what your doctor will actually say in your results, and your doctor will tell you that you actually need to undergo dialysis. Number one thing that your doctor is going to see and recommend dialysis is when your urea level becomes so high. Urea is actually one of the waste products produced by the kidneys as by the body as it breaks down protein. In medical terms, they call it breakdown of protein metabolism. Okay, just because I want you to understand, I'll be using terms that you'll be able to understand very well. So when your body breaks down protein and the waste product becomes urea, okay, it produces both urea and uric acid. So it is the chief function of the kidney to actually remove this waste product from the body. So when the kidney can no longer do this job, you discover that you keep eating, maybe without knowing, and this waste product begins to accumulate. By the time it becomes so high in the body, your doctor can actually recommend dialysis for you. Okay, so it is not something that you choose for yourself. It's something that your doctor will have to go through your lab results, your urea and creatinine results. Some people call it kidney function test, while others call it urea and creatinine test. So with that, you will be able to say that this person actually needs dialysis. In fact, okay, having said this, your doctor also look at your creatinine level. So most of the time, urea and creatinine goes hand in hand, because if you're listening to this video, you would have heard me call urea and also creatinine. So your doctor will actually recommend dialysis if your creatinine level is very high. Okay, so if I'm not going to be saying the level it is, that the level of the creatinine that it's going to be, and your doctor will say you should get you should get dialysis. But most of the time, it is left to your doctor to decide based on the clinical signs and symptoms you're presenting and the results on ground to be able to make this decision. So I'm doing this video for your information, to give you a tip of the iceberg of things that you're going to, so that by the time your doctor will be telling you some things, you'll be able to understand where he or she is going to. Okay, so when the creatinine is very high, you'll be booked for dialysis. So how do creatinine come about? Most of the creatinine you have in your body come as a result of muscle movement. So when you move your muscle, when you do exercise, when you move around, when you blink, as far as you're utilizing any muscle in your system, there's this thing they give out. It is called creatinine. As a result of that, as you're doing exercise, you sweat, you see physical sweat in your body, your system also releases creatinine. This creatinine now goes into the blood. By the time it gets to the blood, the kidney helps to remove them from through urine out of the body. So when the kidney fails, this process of removing them will no longer be there, so they begin to build up. So when it has built up to an extent that becomes dangerous for sustaining life, becomes dangerous that the amount that leaves the body through urine is no longer efficient enough, your doctor may actually say that this person will be needing dialysis, and that is when this person starts dialysis. And in most cases, we're also going to be coming to that when someone has very high potassium level. Okay, potassium is actually one of the vital elements or vital minerals that we actually need in our body. In fact, the potassium actually helps to regulate the heartbeat, to regulate the heart and other things. Potassium level actually works on the muscles, anything called muscle, the most electrical activities of the muscle and of the heart and all the rest of them. So where the problem lies is that when this potassium is not well regulated, it becomes so high. And when it becomes so high, it can actually lead to cardiac arrest. It can lead to a lot of issues affecting the heart. And someone will say the person can actually, it can actually lead to instant death. Okay, one of the reasons why most people who are on dialysis die is because of issues related to cardiovascular health. So if potassium is not well controlled, it can actually lead to sudden death. So if you're a patient here, you're already on dialysis and you're watching this video, I want you to make it an important thing that you check your potassium level at least once in a month or once in 2 weeks to be able to know what it is per time. So I've seen some people who are on dialysis that will just stay for months without knowing what their potassium level is. So if you're watching this, I'm actually encouraging you from time to time to check your potassium level. Another reason why your doctor may actually ask you to start dialysis is when your fluid overload is so overwhelming. One of the things that happen when someone's kidney fails is that they start having what we call fatal edema. So their legs start becoming swollen. So it gets to a point that this becomes so high that it starts becoming so discomforting to the person. Apart from that, it's so high that this person can no longer wear their shoes. It can come to their stomach that this person will not be able to eat well. It can also impact their lungs that this person will not be able to breathe well. In medicine, it is called pulmonary edema. So when this happens, it's actually a medical emergency, and this person may be required to do dialysis immediately. I don't know if you're following me up to this point. So these are the things that you need to check out for. I think 4 things I've just mentioned. You need to check out. That's what most doctors will actually recommend you to do dialysis because of all these things I've actually mentioned. That if you don't initiate dialysis immediately, it can actually lead to serious conditions that can cause death. That is not going to be our portion. That's not going to be the portion of anyone watching this video. So that is why I'm making this video, for us to be at alert, so that most of the times when dialysis is prescribed, especially in cases where in acute kidney injury, the kidney function can actually pick up, and this person will be fine again. So it is better you discuss confidentially with your doctor, who recommends the best thing for you, and do well to follow his or her instructions, and you'll be fine. I'm Onuvo Victor, I'm your kidney health coach. In case you need a personalized guidance on how to walk through your kidney journey, I'll be here to walk it down with you. Then if you have kidney stone, come on, we can help you flush that kidney stone. Thanks for watching. Please share this video to